as humans, we're very resilient. 99.9% of the time, whatever you're faced with, you survive. You puff your chest up and you come through it. But that doesn't mean that you deal with things, you know? And one of the problems that I've always had is I isolate my problems. Brush them to the side, sweep them under the carpet and pretend they're not there. But all those things have a bearing on you. And I guess I've got to a point in my life now where I'm starting to think about having children. And I don't want to pass on any of those problems. So I've actually started seeing a therapist myself. And in 31 years, it's the smartest thing I've ever done.
What's it like?
Good, to be honest with you. I was going to say weird, but it's not weird. It's good, you know. We just sit down, we have a chat for an hour, and I walk out feeling exhausted sometimes. But it's the best thing in 31 years I've done.
You said your dad committed suicide. That was back in 2008. Is it true that in doing that documentary for the BBC, you also found out that this sort of brutal family history, your dad's brother had hanged himself and another brother
2 years 2 years prior, his last remaining brother had hung himself, and I'm named after his brother who had passed before I was born, Stephen, and I never knew that he had committed suicide.
How'd you process
as
that?
well? The therapist helps. When you hear something like that, that there has to be a science behind it. I think there is something genetic there. There is a disposition. There's some people who are definitely more predisposed to it. I was talking to someone the other day. I'm doing a BBC Three documentary next year, hopefully, about suicide, and they were talking about they're developing a blood test to work out who has that predisposition, which I think is great. But yeah, there is a science behind it. I don't think it's all just random.
Knowing that, finding out about that history that was in your family, you must have been quite frightened.
Self-awareness is important.
Yeah, I've got a mate who has a lot of bipolar in her family, and she lived in constant fear of having an episode, and she's been fine. But
like, something that I've learned very recently is to not worry about things that are outside of my control, and life has been a lot better since that.
Hard though, isn't it?
It's not easy, but since I've kind of taken that on board, life has been a lot more fun.
Did you sort of feel, though, given what happened to your dad and his brother, that it was almost bound to happen to you? And did you ever get to the stage where you thought to yourself, I might go the same way, I might take my own life?
Depression is something I suffer with, and anxiety. And there have been points where I've felt uncomfortable in my own skin, but I've never considered how I'd do it. No, I'd say no.
There was a very interesting quote I read of yours on that issue in an interview where you said you never wished that you wished your life wanted to stop, but you wished that things in your life would stop and slow down. Is that the difference, essentially?
I think so, yeah. And that's what I mean about I've never thought about how I do it, or there's never been that moment where I've gone, right, and I think there must be. Like when my father committed suicide, the one thing I wanted was to understand it, and then I quite quickly come to realise that the only way I'd understand it is if I was in that position, and that's not somewhere I ever want to be.